Hello, my name is Dr. Philip McCarthy. I'm director of the Transplant and Cellular Therapy program at Roswell Park Comprehensive Cancer Center in Buffalo, New York. A lot of the criteria that we use for considering a patient for an allogeneic transplant are dependent not just on the type of disease, but also some of the cytogenetic features, chromosomes within the cancer itself, or molecular abnormalities that are now very much being utilized to help us risk stratify. If you have the chromosome 15-17 translocation, where a bit of 15 and a bit of 17 are mixed together, that would mean that you would not need a transplant. You would need a particular type of induction therapy to control and hopefully cure the disease. There are other molecular abnormalities that are high risk, and those patients are at higher risk for relapse. And if eligible for a transplant, those patients are also considered for a transplant from another person. So there's a variety of things that we sit down with our leukemia colleagues, for example, and go over risk stratification. How did the patient's cancer occur, their leukemia? Did they have a predisposing condition? For example, acute leukemias that arise out of myelodysplastic syndrome, those are not as good, and those will often be considered for a transplant. Sometimes certain leukemias will arise out of prior therapy. So for example, somebody who is treated for breast cancer receives chemotherapy and radiation. There's a small percentage who will develop myelodysplastic syndrome or acute leukemia. And those patients would be strongly considered for a transplant if they were transplant eligible.